Hi guys, it's Ashlyn Giza YouTube channel. Um, Today I'm going to talk about the life topic, thyroid cancer. I guess that's not really a life topic because not everybody has thyroid cancer, but that's the topic I'm going to be talking about today. So, um, the reason why I chose thyroid cancer is because I'm a thyroid cancer survivor, which I'm proud to say that I'm 3 years cancer free. So, nonetheless, this is how I found out I had cancer, thyroid cancer. Um, in my previous video, I talk about how me and my husband lost a baby. And so, how we lost the baby was probably most likely due to my thyroid. Now, doctors will tell you that when you lose a baby, more than likely it has nothing to do with thyroid issues. But I've also read online and heard from other people that don't have a thyroid or that have thyroid diseases or just trouble with their thyroid in general, that they had trouble conceiving. So, and that they had miscarriages. So, this is how it started. Me and my husband wanted to conceive a baby, and we traveled 15 hours to North Carolina to a personal choice to meet a doctor named Dr. Monted. Now, he's awesome. I would refer him to anybody. So, anyways, we make it to his office, and the surgery was successful. And he told us that we were able to start trying to conceive, so we did. We started trying, and we did end up uh, conceiving a baby. We got pregnant, but the bad part, the downfall, the sad all part about this, I talked about in my previous video. But the sad part about it was that we ended up losing the baby. So we obviously went through a lot of depression, a lot of hard time, and that passed. But I went to a post miscarriage checkup at my just regular MD physician. They check your lungs, they check your heart, and they kind of feel around on your throat too. And when he felt around on my throat, he felt a lump on my throat, and felt that that was very concerning. So he looked at the nurse and he was like saying all this weird stuff, doctor talk stuff, and he said, let's get her in for a biopsy. So I'm like, oh my God. I said, I'm really scared. Biopsy, why do we need to do this? And he said, well, it's just to be be careful, be cautious. Most of the time it's benign. So I'm thinking, okay, hopefully this is benign. I'm paranoid as hell. My husband's telling me he doesn't think it's cancer or nothing is wrong. Of course, because he's trying to be supportive. But a couple days went by, I got the biopsy, and my doctor calls me back and tells me it's thyroid cancer. So, I didn't even know what thyroid cancer was. I didn't even know that we had a thyroid. I knew nothing about thyroid. I seriously didn't know us. I didn't. I knew we had like an Adam's. Guys had Adam's apples, and um, we have a throat and stuff like that, esophagus and stuff. I just didn't know we had a thyroid, and I didn't know what it did. I had no clue what a thyroid did. A thyroid does everything, but I'll get to that a little later. So I'm finding out that I have thyroid cancer. Um, I'm feeling alone. I'm feeling scared. I'm feeling confused. I'm feeling like, why me? I'm scared about the death rate on it. Didn't know nothing about it. Um, so, uh, the doctor makes a plan for me to see a surgeon and to see an oncologist, and um, I start seeing the surgeon, and we make an appointment for my surgery, and it was a couple days before my birthday, October. And so I went in there. They let me take anxiety medicine because I was having anxiety. Of course, I mean, I think anybody would at that point, cancer and having surgery. And uh, they had me in this room to wait, pre surgery, and they had me on IVs. Um, and then a little bit before the surgery, they gave me like pills to make me out of it and fall asleep and stuff. So, when I started feeling loopy and stuff, the doctor came in and took him and the nurses took me to the operative room. So I don't know what happened there because I was out. So but I've seen it on YouTube here. They cut my throat open. I don't know if you guys can see this. Let me lift my head up more. I have like a scar right there. They cut my neck open so they could get the cancer out of my thyroid, or just take my thyroid out, get the cancer out. So after that, I was brought to a recovery room, and I had a drain hanging out of my throat, with a little bag to drain like any excess fluids that were coming from after surgery, post surgery. So, I rested. They put me on calcium pills because my calcium was out of control. It was very, very low. Um, and pain pills, of course, and stuff like that. And told me I would have a little extra phlegm and a little trouble swallowing because, of course, it was throat surgery. Um, but my recovery was really well. My husband got off work for it. I did have some phlegm and a little trouble swallowing because that's what your throat does when it heals, I guess, is creates phlegm and stuff like that. Um, they gave me calcium pills because I ended up kind of having tingly lips and not really feeling getting numb in my hands and feet. And I called the doctor, and I guess they said that's low calcium. So I went in and got that checked, and sure enough, I was very low. So they upped my calcium, and that eventually stabilized. So, um, the whole process went really smooth. And I ended up meeting with the oncologist. I got put on a hormone medication called levothyroxine. It's generic for Synthroid. And I take that every day, and I have to take it every day for the rest of my life because if you don't take it for months and months and months on end, you will die. like, and It's just nuts to like say that, to like know that even and realize that you're taking a pill to stay alive. Um, but it's very scary and very depressing, and at first, and then you kind of like just begin to like you begin to live your life and not focus on that you're a cancer survivor so much anymore, because what can you do when you're told that you have cancer and then go through the procedure and then you beat it? I mean, dwell on having cancer all the time, like getting cancer back and all that. You can't do that. You would have a miserable life. So, if you found out you had thyroid cancer just now, or you're just curious about what thyroid cancer is or any of that, I'm here to say that it's very scary when you find out. But you know, it's they say, and it's true, it's a fact too, that thyroid cancer is one of the most curable cancers. But it not everybody makes it, so I'm not gonna speak for everybody because everybody's body's different and there has been deaths. But I was one of the blessed ones, and it is very your rates of the cancer being gone is high. So um, tomorrow actually I have an appointment to get my neck scanned. to see if there's any other like weird nodule like or weird looking tumor type things in there and make sure cancer's gone. I have to get my arm poked, some blood drawn to make sure my THS level is normal. And if you Google that, TSH, it will tell you more about what it is. Because I can't really go into great detail with that because it's a lot to explain, and it's hard for me to explain to other people. Like, I know what it is and I know what I need to do to make sure my TSH stays good. And I know the feelings of when my TSH is off, when my thyroid level is off. Because when your thyroid level gets off, you can get all of the above symptoms. You can get like really, really, really super tired, no energy to where you can barely walk. You can get like a rapid heartbeat, almost feeling like you're having a heart attack. You can get really bad headaches, really, really bad ones. And you can get like major anxiety and depression. Those are all things that you can get. Now, I'm not saying that everybody gets them, but those are things that you can get. And there's a lot more too, but like I said, I won't go into great detail because everybody can just Google it. Um, and then what else about thyroid cancer? I mean, you want support. I mean, you want to get on online and probably get in a thyroid cancer survivor group or something of some sort, because it's a really hard thing to live with. And a lot of people will just sit there and like act like you're okay because you look okay. You look like you're a normal person that doesn't have any health issues, when little do they know that you're actually feeling like shit. And it also, like, I forgot to mention too that thyroid cancer can also make you not think really clear. Like, it can make you like brain fog and uh forget your words that you're saying and talk kind of funny and stuff like that. Hence why you probably have seen in my videos now, in this video now, and the videos previous to this one, because I it can make you kind of trip over your words or make you forget what you're saying or forget a word and make you kind of cloudy minded or brain fog up there. So excuse me if I do talk kind of funny, or I seem to forget a word and I don't talk perfect because I don't have a thyroid, and that's one of the things it does to me. Now, it doesn't do that to everybody, but that's one of the things it does to me. So that's why I can sound a little funny or annoying and trip over my words. So, but you want to get in a group where there's a lot of people that don't have a thyroid and are going through the same thing as you, because a lot of people who still have their thyroid, and people who haven't had thyroid cancer, or people who haven't had people who haven't had there it goes see people who haven't had cancer in general, they don't know how it is to have cancer or to be a cancer survivor. And it doesn't make us survivors any better than anybody else. It's just they just don't understand how it is to be told you have cancer, and all of a sudden you feel like you're facing death, um, and the feelings that come along after you beat cancer. Because a lot of people think, oh, you beat cancer, hooray, good job, now you're cancer free, you can live your normal life now. No. No, you can't. It's not like that. When you're cancer free, it just means the cancer's not there for now. um and you have a lot of side effects that you have to live with for the rest of your life, whether it breast cancer, whether it lung cancer, whether it thyroid cancer, any of that. Because, like, think lung cancer, if you beat lung cancer, I'm pretty sure that your breathing still isn't going to be 100%. If you have breast cancer and you get the cancer cut off, I'm pretty sure you're still not going to be 100%. There's going to be side effects, and there's going to be emotional things to go with it too. Like, think if you're a woman and you have breast cancer and you get it chopped off, I mean, you're going to have some emotional feelings like, I don't have boobs anymore, and everybody else does, and, just stuff like that. And if I have a baby, I can't feed them. Like, there's things that us cancer survivors live with that other people who don't have cancer don't understand. So it's always good to have some support from people who do understand. So, but, that was my life topic for today. And if I left anything out or you guys have questions or concerns, you can comment below. But yeah, and there's a Facebook group on Facebook that's called Thyroid Cancer Survivors. That's exactly what it's called. And if you want to join that, that would be great because they really do support each other on there. I've been on the page for a couple years now, so just pray for me, you guys, that tomorrow my scan and my appointments go good and that I stay cancer free and that I beat it again because Lord, I don't want to go through that again. But uh it's very scary, and like I said at the beginning of the video, like us women do want to get our thyroids checked for lots of reasons, but one of the reasons that I'm going to mention is if you're having trouble conceiving, you do want to get your thyroid checked because a lot of doctors say that that doesn't have to do with not being able to conceive, but it really does, because if your thyroid level is at a certain number, you won't be able to conceive if your thyroid level is too high. Well, they say too low, but if it's too high, so let's say if your TSH is like 10 or 20, you more than likely you won't be able to conceive. So, if you are having trouble conceiving, women out there that are wanting a baby and you're having trouble, get that checked. Get your thyroid checked. And everyone else, even if for men, women, anybody else, even if you're not trying to conceive, get it checked. Talk to your doctor about your neck. Make sure that they do a thorough exam of your neck because I asked my surgeon who cut the cancer out what my stage would have been for thyroid cancer if thyroid cancer had a stage, and he said it would have been 2.5. So that just goes to tell you if I wouldn't have lost that baby, um, and had that post miscarriage checkup for him to examine me and feel my neck, they probably never would have found that cancer because I started noticing I had weight problems and noticing I started getting like bronchitis and sick like all the time with a bunch of my immune system was going down. I was gaining weight. Weird things were happening to me, and I thought it was because I was getting older. No, it wasn't because I was getting older. It was because I was having thyroid issues. My thyroid wasn't working properly, and I had cancer in my thyroid and didn't know it. And I was tired all the time and stuff like that, and depressed too, because the thyroid can mess with your mental mind if your thyroid level's off. And so I wasn't knowing what was going on with me, but I'm glad that I met my husband and that he wanted to have a baby with me because he didn't have any of his own, but he wanted to have a baby with me. He wanted to have one of his own. So he decided with me to go travel and get my tubes reversed so we could have a baby. And the happy ending to this story is that we did have the baby and ended up losing it. But out of losing the baby, the doctor found the cancer and was able to cure me. And I've been cancer free. And we ended up having a rainbow baby. We ended up having a baby. Like I said in my previous videos, we ended up having a baby a year later after I was healing from surgery and stuff. after they took my thyroid out. So a year after I lost that baby and became cancer free, we ended up getting pregnant and had a baby, and he's 5 months old now. So um, there is, there's a lot of bad stuff that happen to people, but don't give up, because there's always good things that come to you. There's always a light at the end of the tunnel, like everyone says. So that's my story on thyroid cancer, and I hope that you guys can relate to me. And if you this has never happened to you before, but you know somebody it's happened to, um, now you might have a better understanding on what they're going through. So have a good day, and I'll try to make another YouTube video tomorrow about another life topic. Thank you guys.